Thank you, Mr. President. Colleagues in the Senate, ladies and gentlemen here to observe these proceedings, I'd like to bring before you Senate File 2, a bill for the establishment of a state family planning services program. The program outlined in this bill will replace the current Medicaid Family Planning Waiver Network. This change makes Iowa's family planning services ostensibly state-funded, though it is possible federal money will be used through the Social Services Block Grant, which will allow the state more discretion in how they spend the money than through Medicaid. This change will allow Iowa to restrict government funding to family planning services away from organizations that perform abortions that are not medically necessary. This bill directs DHS to discontinue the Medicaid Family Planning Network waiver effective July 1, 2017, and establish a state family planning services program. The program is to replicate eligibility and other requirements from the waiver and distribute funds in a manner that continues access to family planning services. However, none of the funds are to be distributed to any entity that performs abortions or that maintains or operates a facility where abortions are performed. The bill specifies that this prohibition includes funds for indirect costs or expenses, overhead, employee salaries, rent and telephone, and other utilities. For purposes of the bill, please note that abortion does not include either of the following: treatment for a physical disorder, physical injury, or physical illness, including a life-endangering physical condition caused by or arising from the pregnancy itself, that would, as certified by a physician, place the woman in danger of death. Or treatment of a woman for a spontaneous abortion, commonly known as a miscarriage, when not all of the products of human conception are expelled. The bill requires DHS to submit a report to the Governor and the General Assembly annually by January 1, listing all entities that receive program funds that are in the lowest position of priority, described as non-public entities that provide family planning services but do not provide required primary health care services as defined in federal law, as well as the amount and type of funds received by such entities during the preceding year. The report is also to include a detailed explanation of how DHS determined that distribution of program funds to such an entity was necessary to prevent severe limitation or elimination of access to family planning services in the region of the state where the entity is located. Please note, colleagues, I know for all of us this is an emotional issue. The intimate topic is often difficult at times. I have received many emails, phone calls, and I would like to take a moment to address some of the concerns and questions that Iowans have raised to me about how this will affect women's reproductive health. In response to these concerns, I reached out to the executive branch and received guidance from the Department of Human Services, who will be tasked with administering the new state family planning services program. First, this bill will not completely eliminate tax funding to Planned Parenthood in the state of Iowa. This bill deals specifically with the Medicaid Family Planning Network waiver, which utilizes state tax dollars, but does not address the Medicaid Title X program nor the Teen Pregnancy and Sex Education Grant programs. These are fully federally funded programs totaling approximately $1.5 million with different funding requirements. This bill does not address that. Second, this bill will not eliminate family planning funding for services for needy Iowa women. Last year, approximately $3 million was spent using a combination of state and federal monies. This bill will actually transition the same requirements for covering these women for birth control, for Pap tests, for STI tests, all the same services as currently covered. While this bill is purely policy, it is the intent of this body to actually expand the amounts committed to the purpose to over $3 million, as it is anticipated that access to providers will increase usage of the program. That will take place later in the appropriations process. Next, this bill does not change laws regarding abortion. Please be clear on that. Currently, tax funding cannot cover elective abortions. There will be no change related to that. This bill does not limit or infringe the legal option of a woman to seek an abortion. It is a measured attempt to balance the reproductive health care needs of Iowa's working poor with the objections of the taxpayers to tangibly subsidize that option through public support in shared facilities. Another misconception is that family planning services will be provided by people unqualified to do that job. There is zero allowance in this bill for allowing family planning services to be provided by anyone other than trained medical providers. The added benefit is that those healthcare services will be, in many cases, provided by people also qualified to address the woman's overall health and identified needs that might currently go unnoticed. The positive implications of that alone are enough to garner support for Senate File 2. It's been stated that 80,000 women will lose access to health care, and that is not true. The statement is false. 80,000 is the total number of Iowans who have been covered under this program for the life of the current program. DHS confirmed to me that approximately 12,000 individuals received care under the current family planning system this past year. So to quote Senator Charles Schneider, this isn't a political statement, that's just math. And while that's still a significant number of Iowa men and women receiving treatment, none of those individuals will lose care under the newly designed Family Planning Services Program. Some question has been raised about the process of prioritizing providers and the impact of a huge influx of patients to the first-tier providers. While on the surface I agree that that could be an area of concern, according to the DHS guidance on this matter, it's quickly alleviated. To quote directly from the proposal for implementation of the state family planning system, the funding level is expected to fully fund the program. Prioritization will only be needed if funding is exhausted. To put it simply, all Medicaid-approved providers will be able to provide care to patients, and the expanded group of providers will ensure that the first-tier providers are not overwhelmed nor cause a backlog in service. The prioritization exists as a mechanism for allocating funds to make it a priority to connect women with a primary care provider while they're seeking reproductive health care, as we see that as a direct benefit to transitioning to this state-run program. A final concern brought to my attention was that DHS would be unable to implement the program by the date provided in the bill. Upon the request for information, DHS guidance rejects that notion. They will utilize the same delivery model currently used. They will use the same MOU process with providers as they have used in the past. They will operate under the same qualifying process for patient access that currently exists. In short, according to their own documentation, and I quote, the SFPSP will improve access to eligibility for family planning and family planning-related services and increase the number of low-income people receiving family planning and family planning-related services throughout Iowa. I'd like to share just a few final thoughts regarding Senate File 2 before I conclude my opening remarks. Currently, there are 0 Planned Parenthood clinics, reproductive health care clinics, women's health care clinics that are providing abortions located in my district, in Senate District 14, and that is true in many other rural districts across the state. That means that anyone I represent might need to drive up to 100 miles to seek one of those 12 clinics, all located in urban areas, to access their needed services. Transitioning to the state option will allow every Medicaid waiver eligible clinic, in conjunction with perhaps additional private nonprofit family planning facilities, to provide the same services right where our sisters and our daughters and our mothers live. The increased access and scope of available services by connecting it to a primary health care provider is why I'm such an advocate for this transition. This plan intends to provide a higher level of funding than is currently allocated through the future appropriations process. The same rules for qualifying stand for both the providers and the clients. The only thing that changes here is that any provider who also provides abortions will be excluded from eligibility. As a state, we are clarifying the guidelines for participating in a taxpayer-funded function, which is a standard practice. So if any abortion provider wishes to receive state family planning dollars, they could easily discontinue offering abortions and may continue to do so. We're not closing clinics, nor prohibiting their legal activity. We are not interfering with a private entity to conduct their business. Women will not go without exams or care or screenings. They will just be receiving those services where they live and in conjunction with their broader health care needs. Mr. President, I believe there are amendments.